So this is John Sherlock from Columbia Community Mental Health, and he was willing to talk to you guys a little bit about a data project that he did.
So actually, this was in July. The Washington Post ran an article on July 21st called "Drilling into the DEA's Pain Pill Database." And what they did was they basically provided all of the records for transactions dealing with oxycodone and hydrocodone between the years of 2006 and 2012. This came about as a result of some lawsuits when people were basically saying that these pills were being pushed and the producers and manufacturers of the pills knew that they were addictive and was causing a public health issue. So as a result of this lawsuit, the records were released. There was 380 million records, and the Washington Post released this article, and they released a sort of a visualization dashboard. So this is the actual article. I think we can send out a link. This is just an article on the Washington Post. And, they outline the reason for the release of these records. And the hope is that different localities can look at the data and use it for better public health data. So if we scroll down here, we can see that they have this visualization broke down per county, and you can kind of scroll over and see high-level details. And if you come down further, you can actually choose a state and then a county, and then they provide you some data right here. However, what I was most interested in was the download raw data for the selection that you've made here. So you can choose just the state, you can choose the state and the county, and you download the data. It comes up and it gives you a file that will download as a .tsv, which is a sort of a flat file. And it will include all the records down to the level of the number of pills purchased, which manufacturer produced those pills, which pharmacy purchased the pills, and the dates of each of those transactions. So after I downloaded the data, I had to actually convert it into a CSV file, and then I went through a process of importing it into our data warehouse into a table. I think I have that up here. Yes. So I actually just imported this data into a table I called WAPO Opioid Columbia County. And you can see that there's a lot of details. It's pretty rich a data set. If you look at all the fields. And then here's just a sample of the top 10 records. Now you note that when you're showing reporter, that's the manufacturer, so that's where the pills came from in Washington, and then these were eventually sold at a local pharmacy here in St. Helens, Oregon, in Columbia County. So I guess I should back up a bit and say the reason why I was asked to dig into this data was because a few days after the Washington Post published this article, our local newspaper approached our executive director and wanted to ask about how we were dealing with the opioid crisis here in the county as a result of this data coming out. So that was what prompted this exploration. once I had the data in our data warehouse, then I could start manipulating it and producing some more custom reports. I actually just used crystal reports, and I produced a breakdown of count of transactions per year over the time frame of the data, so 2006 to 2012, and then break down further per year per the pharmacy locally that did those transactions. So I was able to provide this data and this report to one of our staff who ended up doing an interview with the local newspaper, and it was helpful. I think that the takeaway from this is that this data is public, and if you wanted to go out to the Washington Post website and download it, they have a nice tool for doing that. I actually just downloaded the entire state as well, so I have that in a separate file if I ever want to go back and refer to it, or if further questions come up.
That's really interesting, John. Did you look at all to see if the trend in Columbia County was different than the trend statewide?
Yeah, I didn't really do a comparison. I didn't have a lot of time to come back after the initial request, but that would be interesting to look at further.
Yeah.
I was going to say, if you wanted to just look up, say, your state and county, you can see a better kind of informational comparison here. When you select from the drop down, it automatically updates.
Oh, that's nice. That's nice.
Easily compare as well right there.
It's nice they break it down by the number of pills per person. I missed that the first time, but 62 jumps out there.
Right. From the map display here, where the darker colors are the areas of greater pills per capita. So you can get a high-level overview just from the basic tools that they had on the article. I thought that was kind of impressive that they included so much in the article itself, and it's interactive.
Yeah, that's nice. You know, it's interesting because I've been trying to keep up kind of a Twitter account, and a lot of local newspapers did articles on that data, and it's probably because it was so easy to access, you know?
Right.
Yeah. Yeah, like that's really interesting. It's interesting how, like in Oregon, because I'm more familiar with our geography, you can really tell how the problem was more highly focused toward like rural area. Like Oregon's geography is kind of easy because basically there's a strip of metropolitan area down the. Do you want to point where it is, John? There's like metro areas like down, you know, north to south from there down, you know. And like if you look at the darker colors, they're more in the rural areas. They're not so much in the metro areas. Right.
That is interesting.
And like poor Northern California, gosh. It's interesting. Yeah, because like Northern California is less populated than Southern California, for example.
Yeah, and then if you look over on the east here, we have really high per capita numbers.
Yeah, like Appalachia.
Yeah.
Wow. Well, thank you so much for sharing that, John. I think that's a really interesting way to use data. Yeah, it makes me be curious about things like I wonder if you could compare like how the trend in prescribing compared to, like, I would assume there'd be kind of that wave of that and then a secondary wave of people getting treatment, like if the number of people presenting for opioid treatment sort of had a similar climb, but maybe a little bit delayed from that. Like that would be really interesting to see, like the shift in number of people presenting for treatment from like 2006 on. Although I know not everyone has data in one system from that far back, but you could almost like compare across systems or something.
I'll say a couple things about the data though. When I first downloaded it, I wasn't familiar with the TSV format, and I don't know if there's a better way to handle it, but I did have to open up the file within Excel and then convert it over to a CSV format before I could import it into the data warehouse. And now that step was important because I first tried connecting to the data source simply with Crystal, and it was just so slow that the performance was not there. It would have taken forever to work with it. I'll also note that the date formatting was kind of odd on this. If I can show you.
Oh.
Yeah. I was able to sort that out. I don't remember exactly. Oh, yes. So you see, like, we have 4/1/2/2011. Well, that's April 12th, 2011. So I had to really manipulate it quite a bit just to get down to be able to filter on that.
Oh, did you use a formula or something for that?
Yeah, I just used a formula like trim off, part of the string, and then I labeled that as the year part, and then I separated out the month and the day. So.
Okay. Yeah, it'd be interesting to look at that by like day of the week.
Oh, right.
Like, because there's all these theories about how, like, there's theories out there about that people who are maybe getting more opioids than necessary might be more likely to be getting those prescriptions, like, by going to see more than one doctor, or maybe going to a pharmacy that, and I wonder if there would be a pattern of seeing that, like, more common on the weekends or more common on a Friday, or, yeah.
Yeah, I bet it would be. That would be interesting to look at.
And I think I see on there the MME conversion factor. I think that's like the morphine equivalent, right? Like below measure. Kind of toward the bottom, that one. Huh.
Oh.
Yeah, because I've seen something like that used to like describe how strong, like the strength of the medicine. But I'm not sure how to use that. I didn't know if you'd looked at that at all.
No, I couldn't really find metadata or description of the field.
Interesting. Okay, well, thank you so much, John. We saw that John had done this, and we thought that was something that other folks might be interested in, and it's kind of a cool use of the data warehouse because, theoretically, you could, if you have data in your system about, like, for example, maybe meds you guys are prescribing, or the day that maybe, what would be interesting is there'd be all kinds of interesting things you could do, right? Like by zip code, by city, and then see if there are similar trends in who's presenting for treatment, or, if your trend line was still going up in 2012, like maybe that would tell you something about like where things are likely to go for demand for treatment. And anyway, I think it's pretty interesting. Well, thank you so much, John. I really appreciate you, being willing to talk with us about that. And, I look forward to hearing if anyone else does other interesting things with that data, and maybe we can ask about that next meeting, see what people have done. So, great.
It was interesting, and it did help with our interview that we did with the local newspaper.
Cool. Well, thank you so much.